Well, in today's Wellness Wednesday, kids, they're heading back to the classroom for the spring semester, but some are still learning from home. They're taking part in that hybrid learning. So how can families keep their students focused while adjusting once again to this new normal? Well, joining me now is Regents Medical Director of Behavioral Health, Dr. Hassem Mahmood. Good morning, doctor. How are you?
Good morning. Doing well, thank you. Good to be with you.
Yeah, likewise. Well, first, we're nearing a year into the pandemic, and routines, they keep changing, even though we're mostly staying at home. But how important is it to find that balance early on?
Yeah, that's a great question. I mean, I think for the time being, uncertainty has really become part of the new normal, at least for the time being. And what is important in this situation is for families to figure out what the new normal means to them and what a new normal for them is. I think part of that is focusing on what is important for different family members, being open and having conversations, especially with kids, about what they're struggling for, in order to be able to support them with all the uncertainty that's going on.
Now, and parents, they're having to balance so much right now. What should they do to keep that cool head and keep their focus right now?
Yeah, you asked $1 million question, right? I cannot emphasize how important it is to practice self-compassion during this time, because I think if we continue to expect the same from ourselves as before COVID, I think we can end up being very hard on ourselves. And I think it's important to be compassionate with ourselves and kind of readjust the goals that we had. I think it's important to practice self-care and build resilience as we navigate this uncertainty. But overall, I would say I am feeling hopeful that with the rollout of the vaccine, things are moving in a positive direction. And so I would try to focus on that. At least that helps me cope with all the uncertainty and the stress.
Sure, like light at the end of this tunnel. And if someone is just having so much trouble managing it, who can they turn to for help? Who would you say?
You know, I am really a strong believer that one social network, and by that I mean close loved ones, family members, and close friends, is very important. I think it's very important to reach out for help from close ones that you trust, and at the same time to be there for them, because there's something so fulfilling and satisfying and empowering in helping others. I do think that if folks are feeling overwhelmed, where stress is really affecting their ability to function, ability to function, be it at home or at work or at school, is to talk to their personal physician. Typically start with a primary care physician and ask them for help. At times they might decide that you need to see a mental health provider, and at times they're able to help themselves. I would also urge folks to reach out to their health plans homepages, because at times there are a lot of resources for COVID and for mental health resources on there.
And sometimes, you know, and last question here, it might be a little bit more than just typical stress or anxiety. When do you know you need professional attention?
Absolutely, that's a great question. I think the determining factor is whether that stress and anxiety are affecting your ability to really live your life, in the sense that whether you can function or not. So I would say if you feel like you can't get out of bed, if you're feeling hopeless, I think it's definitely time to reach out for help.
Doctor, thank you so much.